Hello, everyone. This is your host, Alex Balgood, and this is Leap of Health. And today I'm super excited because we have Virtu Arora. She's actually my former instructor, which I'm so happy to have her here. She's a manual lymphatic drainage certified instructor. She's been teaching for like about 7 years, and she's been in the field for about 15 years. So that's like a long time in this field. So that's super cool. And she's also a physical therapist. Thank you for joining us today.
Thank you, Alex, for having me, and I'm happy to be here.
Thank you. And before we dive into the whole lymphatic drainage and what it does to us and all the goodies, if you can tell us a little bit about your story and how did you become a lymphatic drainage certified instructor?
So, I was a physical therapist, and I encountered a patient who had swelling in her arm after breast cancer. And I realized, even with all my PT training, I really didn't know how to help her. So I looked more into it, talked to other therapists, and that's when I realized that there is a therapy available outside called the lymphedema or lymphatic therapy, which involves the manual lymph drainage, which is one part of the lymphatic therapy. And I got more curious and more interested. And finally, in 2006, I completed my certification in lymphedema therapy through the Academy of Lymphatic Studies. And I've been doing and seeing those patients ever since. And there's a huge need for lymphatic therapists in the country right now.
Yeah, definitely. I agree with you. I don't see a lot of people. I don't even think a lot of people knows about this modality that could be really helpful. And I know you mentioned lymphedema. What's the? Let's actually back up a little bit. Can you explain a little bit how the lymphatic drainage works or the lymphatic system works?
Yes, definitely. So, in our body, we have two lymphatic systems. One is a deep lymphatic system, and one is a very superficial lymphatic system, which is just under the skin. When we talk about lymphatic therapy, we are mostly talking about the superficial lymphatic system that's just under the skin. It drains the lymphatic loads of the skin, and skin is the largest organ in the human body, so it has a lot of drainage. And if that drainage is affected, then we end up with swelling, puffiness, and many other complications related to that. Um, so the manual lymph drainage actually helps the superficial lymphatic system to drain all those substances back into circulation so we don't end up with swelling. I would also call manual lymph drainage as a detoxification treatment because it removes, along with those lymphatic loads, it removes all the toxins from our body.
Yeah, I feel like in our society now, a lot of people gets like swollen or puffy, um, and they think it's normal. And that was like a very big shocker for me because I know, at least for me in my body, I'm like super sensitive. I noticed even if you know, like everybody else goes to a party or whatever, and I overdrink or whatever, not anymore, but like before COVID, you will go out, have a drink or two or whatever, and the next day you feel swollen. But then people started, I feel like people starts to see that as a almost like a natural state, like it's normal to be swollen. And when I went to the certification and all that, it was a big shocker that it is important not to be swollen. Can you tell us why?
Why it is important not to be swollen? The swelling can be localized or the swelling can be more generalized.
Okay.
Um, Swelling itself has some negative effects on our body. It interferes with healing. it because of those because of the swelling, the toxins are not getting drained, so you may have more pain. And then when you're puffy, let's say your hands are puffy and you try to make a fist, you see that you're not able to make a full fist. So it interferes with the joint motion, muscle strength, healing, wound healing, pain. So swelling itself has a lot of negative effects. And it is important that we bring our swelling down, or prevent it from happening as soon as we can.
Yeah, for sure. And even if it's as I said, sometimes, especially if we drink or something, the next day some people might get swollen and they might be like, oh, it's okay. But imagine if you do that like all the time, all the time, all the time. What exactly happens to our lymphatic system when we expose ourselves to all these swollenness? What is for like drinking or any other toxins that we put in our body, and that's why we get swollen. What exactly really happened to our lymphatic system?
So, if you're feeling puffy or swollen, the most common example I can give is people are usually puffy at the end of the day, their ankles swell up,
Mhm.
or some people, if you take a flight and then you'll see your feet or ankles swell up by the end of it. Some people eat too much salt and next day they feel swollen.
Right, right.
So, we want to get rid of or prevent or get rid of that swelling as as soon as we can. And manual lymph drainage, your diet, your exercise, elevation helps with this with the swelling. So I know I'm missing one part of your question. Can you say that again, Alex?
Yeah, no, I was saying that the importance of um not being swollen, and I think that the second part of the question was like, why is important, what actually does to our lymphatic system if we continue to be swollen for a long time? Because as I was mentioning before, I think we in our society now, we are seeing or feeling this as like, oh, it's just normal, I'm a little swollen, whatever, I'll go away. But it really has a really big effect on our lymphatic system. And if you can tell us exactly what that long-term puffiness does to us.
So yeah, so if there is an off and on swelling where it goes away, okay, no worries, but still talk to your doctor and look into compression needs. But if that swelling, that fluid stays in our interstitial spaces or in our tissues over a long period of time, that quality of fluid itself, lymphatic fluid itself changes. It starts getting harder and thicker, and it can lead to frequent infections in our body. And of course, it causes one arm or one leg looks bigger than the other. Sometimes people can fit in their regular shirts because one side arm is so tight. Um, so long-term swelling sitting there can cause multiple complications. And if you have lymphedema, actual lymphedema, after breast cancer surgery or causes, other cancer surgeries or other causes, and it sits there for a long time, and you don't get treatment for it, very rarely it can cause a cancer of its own too. Um,
Mm.
so we don't like to see swelling sitting there for a long time. If anyone feels puffy at the end of the day, which is better in the morning, that's their body already telling them do something about it. I am getting stressed. And at that time, just wearing light compression, over the counter compression stockings for the legs would really help prevent many complications in the future. Um, so it does damage the lymphatic system. The swelling that's sitting there, our lymphatic system is working very hard to keep our body clear of swelling. So when you actually start seeing swelling, that means our lymphatic system is actually getting tired,
Hmm.
and it's going to get more tired over time if we don't help it, and then we're going to see permanent swelling. And after that, there is many complications that can happen with permanent swelling. Like I mentioned, infections, skin changes, cosmetic changes, size of the limb, and in very rare cases, um, if the swelling was after cancer, it can develop a malignancy of its own.
Yeah, for sure. It's super important for everybody. I'm not saying, you're not gonna get swelling. I think we all get swelling. As you said, that was a really good one that I keep forgetting. High levels of sodium also can, and I think that's probably the most common. And everyone, we keep adding fried food or, fast food, and they contain a lot of sodium on its own. So I think, yeah, that will be one of the most common things that get us swollen. And people are like, oh, okay, I'm good, I'm healthy. But I think what we need to understand here is that right now we are healthy and we're like a little puffy. But if we don't take care of ourselves, the lymphatic system will eventually be compromised and develop some other diseases or problems. And I like that you emphasize that the lymphatic system is helps us detoxify, because I feel that because I know the lymphatic system gets detoxified by lymphatic drainage and by exercise mostly,
Yes.
right? And so if we don't exercise, if we don't eat well, are gonna be adding up to us in our lymphatic system not be well. And that's very critical right now because of our immune system.
Mhm.
How is the lymphatic system related to our immune system?
So lymphatic system is actually plays a very important role in our
Mhm,
immunity. So our lymphatic system also has something called lymph nodes.
mhm,
Lymph nodes are like the first line of defense. For example, let's say you got a scratch on your leg and some bacteria got in, and that will travel up with the lymph fluid to the lymph nodes of the leg, which are inguinal lymph nodes. And lymph nodes have different chambers inside them where they filter, they identify this foreign material or foreign bacteria, and then they produce antibodies, lymph node stimulating antibodies against it. And they will, we have other fighting cells in our body who will come and eat up this bacteria. Um, so lymph nodes play a huge role in our body's immunity. Another example I can give you is when we inhale spores or tar or dirt with our breathing, and then we have lymph nodes right here, and they help fight all that foreign material, foreign bacteria, by producing lymph node stimulated antibodies or antigens against that foreign material. So it plays a very important role in immunity.
Yeah, and I feel like it's super relevant now that we've been on this coronavirus era for almost 2 years. If you're hearing us now, we're on summer of 2021. So yeah, it's been like almost it's gonna be 2 years soon where we've been in this coronavirus. And so yeah, taking care of your lymphatic system is gonna be crucial for you to not get easily sick and protect your body from anything, pretty much bacteria, viruses, or anything that will be, attacking your body in this case. And I know once the body gets swollen for a long time, it will eventually develop diseases. What are those diseases that people can develop when swollen? It's been like super chronic for many years, and people has not been taking care of their body.
So there are different ways we can get swelling. The most common in US, in United States, would be we all have varicose veins and spider veins and
Mm.
venous issues in our legs. If we don't take care of it over time, our legs are gonna get swollen more and more, and then we'll have permanent swelling, which we call lymphedema.
Mhm.
And once lymphedema develops, there's a whole disease process that follows after that, including multiple infections, wounds, leakage, non-healing wounds, um, cellulitis. So that's one of the ways the disease can progress. Another way we get swelling is surgeries: total knee replacement, ankle surgery, arm surgery, breast cancer surgery, prostate cancer, radiation, even radiation, not just the surgeries. Sometimes we're doing like a facelift or a tummy tuck. Uh,
Mhm.
those surgeries also can cause swelling. And if it stays swollen, then it will interfere with the healing process. So we have to, compression is one of the good ways to manage swelling before it becomes lymphedema or it becomes out of control. Um, so compression is one thing, and watching what you eat. Salt, salt is the big one. We do not ask anyone to limit the amount of water they take. They should drink normal amounts of water. If they want to limit something, that would be salt.
Yeah, for
Um,
sure.
yeah.
Mhm. And once the people have developed lymphedema, which is like a really awful disease, um, know that there's also still help for you. And what do they usually do for lymphedema patients, which is like extreme swelling in the body?
Yeah, so lymphedema is a disease process where the lymphatic system is now so tired and so damaged that it needs help big time. And lymphedema goes through stages: stage 0, 1, 2, and 3. And stage 3 is that lymphocytic elephantiasis, those huge legs you see photos of.
Mhm.
Um, Now, for lymphedema, we do a special therapy called complete decongestive therapy, CDT. And most of the time, doctors would send patients to a certified lymphedema therapist. And there are four components to complete decongestive therapy that we do. Number one is manual lymph drainage. Manual lymph drainage plays a very important part. And then we educate them on skincare, infection precautions, wound prevention. That's the second part: skincare and patient education. The third part is compression. So if lymphedema has already developed, then we have to start with compression bandaging,
Mhm.
where the entire leg or the entire arm stays bandaged 24/7. Even for shower, you put a plastic bag on your bandages and take a shower. And this process goes on for 3 to 4 weeks until we have decongested as much as possible. And it does not end there. After that, once the arm or the leg is fully decongested or decongested as much as possible, they will have to now wear a compression garment. By that I mean compression arm sleeve or a compression stocking for the legs. And some patients need daytime compression and nighttime compression. The important thing to note here is that lymphedema, there is no cure for lymphedema right now in the world. We can only manage it. And even though I say wear compression day and night, it is a lot to handle. It is a lot to handle to stay compressed all day and all night, and without compression, they swell up again and they end up in therapy again. So, so to prevent all those complications, if you're seeing off and on swelling, go to your doctor, start taking care of it, wear light compression, watch what you eat. Prevention is always better.
Yeah, for sure. I mean, definitely no one wants to get to the point of developing a disease, right? And yeah, for sure. If you, because this could happen to younger people. Like
Mhm.
this is not just like an old people disease or something like that. It's pretty much, you could be young and look healthy apparently, but if you have swelling in your body and you're compromising your lymphatic system, you could eventually develop this awful disease. So yes, definitely prevention, it's a key for this. And on that point, I know I know myself, I was a little confused on what it was, lymphedema and lipedema.
Yes.
Can you tell us what's the two difference between that?
So lymphedema is more common, and lipedema, we are now trying to understand. It's a fairly newer diagnosis. I would say in last 50 years, there have been more and more studies about lipedema. Lipedema, as the word says, lipid. These patients are born with it's genetic. They
Mhm.
are and mostly women. It affects mostly women. These are the women you see who are very slim up to the waist, but from hips down until the ankles, they are disproportionately large. The feet are normal again, but from hip to the ankles, they have these high fat deposits in their legs, and both legs equal and symmetrical, looks big. And they've been to the doctors, and they've tried every diet in the world to get rid of that fat, and nothing has worked. Nothing has worked. They're mostly said, "Oh, you are obese. Go work on losing weight." It is not that. It is an actual disease process called lipedema or lipedema, where there is excess deposit of fat between the hips all the way down to the ankles. The feet are normal again. And lipedema, again, we recommend that you wear compression all day, because all that heavy fat deposit is ultimately stressing that superficial lymphatic system. And if not taken care of by wearing light compression leggings, um, those fat deposits will keep on stressing the lymphatics over time, and then they will end up with lymphedema. So the
Right.
leg will finally go into permanent swelling. And now, once it becomes lymphedema, it is a disease process. There is no cure for it. And you have to manage it with diet, exercise, compression wear, day and night. So it's a very um, particular management process if it becomes lymphedema. So catch it in the stage of lipedema or lipedema, and start wearing light compression leggings from there. There is a surgery, new surgery. It's called SAPL, SAPL, suction assisted protein lipectomy, that they are doing for lipedema. Because this fat is so stubborn, you no diet and nothing else have worked in removing that fat. Um, so there is a surgery where they go in and remove. But after that, also compression is extremely important, and these patients will have to wear compression for the rest of their lives. And every year they'll have to buy a new compression stocking. But I know many patients who've gotten that surgery done. They are okay wearing the compression, but they feel much better after all that heaviness has reduced, and their arms or legs are looking a little bit more towards normal size. So that makes them really happy and changes their entire outlook towards life. There is a diet. Um, there is a diet, and I would recommend that if you're looking for a special diet for lipedema, please go to lipedemaproject.org, and there is link to dietitians. There's been some talk about the keto diet, but again, I always recommend my patients to consult a nutritionist or a dietitian who specializes in lymphedema um, nutrition or diet, and especially lipedema diet.
Yeah, for sure. It is important that if you think it's now you have developed some serious disease or you're not feeling well, always consult with your physician and see the alternatives to what you can do with what's happening with your body. And going back on that lipedema disease, you said it's genetic. When can people, at what age can these people notice, like, oh, I have this, I need to start taking care of myself? When are the first symptoms that happen, and can people be like, okay, runs in the family, I should get checked?
Yeah, I would say around puberty,
Oh, wow,
they
very
should start.
early.
Yeah, they should look for it. Also, they will notice they have aunts, mom or aunts, females in the family, um, who have similar disposition where they are heavy waist down. Waist up, they're very very slim and very normal, but waist down, they're heavy. So if they see other family members like that, especially females, um, they should look into it.
Okay, yeah. So for anybody out there listening, so if you have someone, aunt, mom, or even maybe grandma, it could have skipped a generation, who knows, that would have this disease, or maybe they didn't know she had this disease, and maybe she was just pretty big from the waist down, and you are in about that range age, do go to your physician and just get checked. It might be nothing, which is cool, but I think prevention and catch it at a very earlier age is better than uh, go ahead and have this disease develop and catch it when it's too large, because it can get really, really large, right?
Yes, it can go to elephantiasis stage. It is very hard to manage because of the being overweight with lipedema. It is very tough to manage if it becomes lipolymphedema.
Yeah, for sure. And I think, you know, personally, I had no clue about this disease. And I know, like, growing up, I might have seen one or two women that honestly I thought, like, they were just obese. But in reality, sometimes we can get a little judgy out there and see females with a very large, from the hip down, and think like, wow, that person is super obese. Why are they not, like, going for a walk or um, diet or whatever? But as you said, this is an actual disease. It is a genetic disease. It does not go away with just with diet or exercise. You could be on a diet and exercise for like the whole day, for your whole life, and the fat deposits will not go away. So if you, or someone that might have some sort of this condition, it will not disappear, it will not go away, this disease, but at least it can get some sort of help and have a better quality of life, which is reaching out to your physicians, and eventually, you'll end up with a lymphedema drainage, right? Is that how we call it?
Yes.
Yes. So definitely that's like super important. So yeah, so for everybody out there, remember the lymphatic system, it's super important for all of us to take care of it. It's our first line of attack to all virus, all bacteria, anything that's wants to enter in our body. So exercise, and it's great. And also lymphatic drainage, it's really, really good, even if you're healthy. So I feel that manual lymphatic drainage, it's super popular with people that has had surgeries, or plastic surgeries, or cancer surgeries and all that. But I feel like manual lymphatic drainage should be a preventative method for everybody to do. What's your take on that?
I think manual lymph drainage, you if um if you felt it, it's very light, very soothing, very analgesic. Um, it relaxes you so much, and it also helps with detoxification in the body. So manual lymph drainage is a very good treatment modality available to us. When I first learned manual lymph drainage, I still remember those words. In our life, we always try to do more. We are always like, do more pressure, do more, or we try to hold on to or grab onto things and we want it in our control. But that's the first time when I learned manual lymph drainage, I learned to let go.
Hmm.
Let go, and less is more. Less is more. Manual lymph drainage is so light, just moving the skin in a very lightly and a very rhythmic way, um, that it has so many beneficial effects for our body. It helps our lymphatic system, it helps with detoxification, it helps with the muscle and the joint pump, it reduces swelling, it improves circulation, and we also do diaphragmatic breathing as part of the manual lymph drainage, which in itself has so many good physical effects. Plus, I also feel that diaphragmatic breathing helps reduce your anxiety and stress also. Um, so I really love manual lymph drainage. It is a great tool, even if you don't have swelling and you do manual lymph drainage, it is still very beneficial to your body and it will relax you. It's analgesic, um, and it's very holistic, very wellness oriented.
Yeah, for sure. Yeah, so I think for everybody that's listening, uh, take on that note, manual lymphatic drainage, it's really good for everyone, even if you're healthy, because it's gonna help you go through this detox as you go through the therapy. So it is really, really good for everyone in general. This is not just for people that it's already has a disease or they're sick or anything like that. So this is for everyone. And people might ask, is this for kids too? Can you take kids to have some lymphatic mallow drainage?
Some children are born with lymphedema too. They have some
Oh,
genetic
okay.
problem, or lymph nodes are missing, or so some children are born with lymphedema, and we do teach their parents how to do simple MLD on the children. It is safe for everyone. Yes, you can do it in children and babies also. Um, I have done it for children who already had the problem, not the normal kids, and it's beneficial.
Yeah. How about for pregnant women? Is this also recommended for them?
So for pregnant women, they have the baby weight that pushes sometimes on our veins or on our big lymphatic duct, and pregnant women can have swelling in the legs,
Hmm.
ankles, lower legs, especially during the last trimester of their pregnancy. Also, there is another condition where the weight of the baby or the fetus is pushing on the veins and the lymphatic ducts, that they get valvular swelling. It's not that common, but some women can get it during especially the last trimester of the pregnancy. And manual lymph drainage is beneficial for you can do it on their legs. I don't like to touch so much on the abdomen when they are pregnant. There is just so much going on there, but you can definitely work the entire leg, have them do some breathing, light breathing, diaphragmatic breathing. And for pregnancy, with the leg swelling, there are special pregnancy compression stockings that come, and they help a lot with swelling until the baby is born. Sometimes, very rarely, but sometimes, the swelling may persist even after the baby is born. And it's not going away, it's consistent. Even when you wake up in the morning, the swelling is still there. That's the time I would recommend them to go see a doctor or a certified lymphedema therapist, because sometimes pregnancy can be um, the cause where they were born with a deficient lymphatic system, but they had no issues until they had a surgery or a trauma or the pregnancy that can bring on the permanent swelling or lymphedema. So, if the swelling does not go away after the baby is born, and you've checked it out for a few months and it's not going away, then go ahead and consult your physician and see a certified lymphedema therapist um, to check and follow up on that.
Yeah, for sure. That is so amazing. We can do pretty much anyone can, have a manual lymphatic drainage and be super beneficial for them. Even pregnant woman, as you heard, if the swelling keeps going for several months after you delivered the baby, definitely check on your physician. I think that's one of the main ones. If you feel like you're swollen for a long time, definitely consult your physician. And it might be nothing, but just, get checked, make sure you're getting some sort of help in that area. Uh, well, this has been amazing. Thank you for all the information that you gave us today. Uh, we realize how important is the lymphatic system and how to take care of it and all the things that come with it if we don't. So that was really good. Thank you. Thank you, Virtue, for being here today. If anyone wants to get in touch with you or has any other questions, where can they find you?
So, first of all, I want to thank you, Alex, for creating more awareness about manual lymph drainage and how it can help in various conditions. Thank you for that. Thank you for creating awareness. We love your program.
Thank you.
And secondly, just for your program, especially, we have created a discount code. So if anyone would like to learn manual lymph drainage certification, there is a 10% discount code that Alex will share. And that discount code is valid on the Academy of Lymphatic Studies, acols.com. To further contact me personally, you can reach me on my Facebook, which is Virtu PT, and you can message me there or reach me on my email, virtupt@sbcglobal.net.
Awesome. Thank you. Yes, if I will be putting all her information in the show notes, so you can also check the discount and all the classes and everything that she offers too. And if you need to know anything more about me or the show, please reach me out to alexbalgood.com. You can find me on Facebook, Instagram, YouTube, everywhere. Just send me a message if you have any questions. Thank you, everybody, for listening today, and have a blessed day. Thank you.
Thank you.